I'm continuing on from yesterday where I spoke a lot about my hip replacement, what I regretted, what I should have asked that would have made all the difference in the world for me. And I talked just briefly about how I didn't have any setup at home. And I don't want that to happen to you. Okay, so if you're interested in that first one, I'll put it below. But in the meantime, today, this one will be much shorter. This is not the lengthy story. I'm going to get right to the point and tell you what I think the most critical and essential items are that you need when you are preparing your house when you come home from your surgery. Now, I'm talking about a hip replacement or a knee replacement. I had 2 hip surgeries, so I learned what really I didn't need and what I absolutely needed, and I want to share this with you. But this can also be for other people coming home from the hospital, and what your space maybe could be like that would benefit you and help in healing. For example, one of the things I'm going to talk about in a moment is aromatherapy. I'll put below the articles on how aromatherapy truly has been proven to help people after surgery, and I will list all those articles and talk a little bit about that in a moment, but let's jump right into what I didn't have that I absolutely needed and ended up having my husband go out and buy. First thing for me was a bedside commode. I don't care if everybody says tough it out and walk to your bathroom, or you only have one bathroom. I once lived in military housing where we had one bathroom. It was upstairs. So I think that it doesn't do you any good to force and strain and try to get yourself into places, especially when you urgently need to go use the bathroom and you're fresh out of the hospital where you've had boluses of fluid maybe for some reason, or you've had a lot of fluid in the OR and you need to pee a lot. Plus you're drinking, you're trying to hydrate yourself. So you are going to go to the bathroom a lot. That doesn't mean you're not going to get up and walk. It doesn't mean that you're not going to get yourself closer to the bathroom in time. But for now, that's going to help you immensely. The second thing is a raised toilet seat. I did not have that at first, and it made all the difference to have a raised toilet seat. I'm going to put pictures of what some of these items look like, and I will also list below where you can get them from Amazon, but you can also get them ahead of time by going to a medical supply store. Oh, and I want to mention for men, the bedside commode, yes, for males or females, but also they have urinals, and the urinals I think are $5 or $6 off Amazon, and it would come in a day or two, and that would be beneficial for gentlemen. The next thing is a walker. Usually a walker will be delivered to your hospital room, and that is what you're going to go home with, is that walker. That is not always the case. And sometimes you are to prepare ahead of time, like I'm talking about, but have your walker at home. So a walker is critical. And a cane is very important too. And you want to make sure you have the cane for safety purposes that has the thicker rubber grip on the bottom. You could get canes anywhere, Walmart, any pharmacy, and again off Amazon to have it delivered. The next critical thing is a shower chair or a shower bench. But it's important to have a shower chair or bench that again have the grippers on the bottom that are suction. This is just all about safety, because you're not going to be able to like sit down gently like you're used to. You're going to probably come down for a while onto things when you sit down with a little bit of force, and that would move the chair. Some people use like a camping chair, and some people use a beach chair. And I guess if that's what you have to use, but it's not going to be as safe. You want something that's going to grip to the bottom of the bathtub or shower, preferably shower. Bathtub would be really difficult to get in and out of. If you don't have a shower chair, you don't want to use a shower chair or bench. I didn't have either one of those, but I did put in those gripper strips. And I started with these big round flower-shaped sticky adhesive things that go onto the bottom of the shower. But then over time, they lasted about 6 months. So I got rid of those, and then we put in the long strips that we got from a hardware store. I talked a little bit about this in my first video about physical therapy. You're going to be starting PT right away. Now, I have heard that more people with hip replacements choose not to do physical therapy. My physical therapists have told me that. They just don't do it, or they get a few things that they are to do at home from their surgeon and they don't need to come in and do anything else. I started physical therapy within the 5th day, and I would have opted for home PT. So that is just something to keep in mind to prepare yourself for when you come home. You're going to have all these things in place, and you're going to make sure that you know if your insurance will cover home physical therapy, if that's something that you're interested in, versus getting in the car and having somebody drive you there. Having ice packs is also a really good idea for hip replacement, not critical. I think I used ice packs for the first 24 hours when I got home from the hospital, and I didn't use them after that. Also, have you seen, I'll put a picture up of these grippers. They're long and you squeeze the end. I couldn't find mine to show you personally, but we still use it. We use it around if some socks and other things drop on the side or behind the washing machine or dryer. But that came in really handy because you might be resting in bed or in a chair of some sort that you're going to be in for many hours out of the day, between your walks, between physical therapy, between standing up for a little circulation, you're going right back probably in that position. And then you drop something. Somebody isn't always around to help pick it up, but that gripper is really helpful to get that for you. The next thing, not essential, but really makes your life a lot easier, is to have some sort of caddy or basket or bowl of some kind where you can put all your things in there. You can put your medications in there, your chapstick, your phone, your charger, whatever else you want in there that you need, instead of having to reach to get it or ask somebody to get it for you or lose it in the bed. You've got your earbuds and all your things are in that caddy next to you. Kind of along the lines of the gripper, I didn't have this, and I never did get it, but I have since talked to other people who really loved having the leg strap. So when you're getting in and out of bed, or often on that lounge chair or resting chair that you have, oftentimes at the beginning, you will need somebody to help with your leg. It's kind of hard to explain until you have it done why that would hurt so much or why that movement is something you need a little assistance with. But I had somebody to help me if I needed that. Instead, other people often use, I'll put a picture, but it's a particular strap that they use to help assist when moving their leg. 2 clothing items are the non-skid socks. You know, those non-skid socks, that's really important too. I know a lot of people will just use the ones they get from the hospital. That's okay too, but it's always good to have extras. And the other thing regarding clothing that I wanted to show you is that I think personally this helped me tremendously. I needed something I didn't have to fumble with or pull hard down because you've got dressings. When you need to get up and use the bathroom, or take a shower, get undressed for any reason, you're going to want loose shorts. Now, these are exactly what I used. I had several pairs of these that I bought ahead of time, I thought ahead of time about that. And these are from Old Navy. You can get this kind of thing anywhere, but I had several pairs of these and they were so easy. Here's another pair, this kind of a thing. And it was just super helpful. And with men too, most men's shorts are kind of on the looser, easier to manipulate. Ladies' shorts, not as much, but you probably don't want anything that has a zipper or long pajamas or legging type things, because in my opinion, with my experience, it was just a lot easier to maneuver in this kind of a short after surgery. In that caddy or bowl or basket, another nice thing to have is a notepad and pen, or a couple pens, because if you drop one, you might get it with your gripper, but you might not. So keep some pens handy there. Anything that you can think of that's going to make your life easier. How about something to lift your spirits? Do you use not just your phone, but maybe you use a tablet or you have a TV? Consider, or ask your friends, consider looking it up, or talk to your friends about what they are watching or what series that they loved. The one thing I watched was Wentworth. Have any of you seen that? I think it was on HBO. No, it wasn't. It was on Netflix. Okay, it was Wentworth. It's about a ladies' prison. It was gripping, and I watched that every night. I looked forward to watching that, and I got through the entire seasons, and it was really something that kept me going. It kept my interest. But get some books ready. Talk about what you want for in terms of people visiting. So moving on with home. Before the surgery, I cleaned my house like sparkling clean top to bottom. Anytime I go in for surgery, I do that because I know I'm not going to be able to clean for a long time. But other people in the family can, of course, do their share of the cleaning. But if you want all your laundry to be done, you want all that kind of thing to be ready, you don't want anything on the floor that's a slip or trip hazard, get everything cleaned off your floor, and talk to your family members about that. The newspapers or books or garbage or any kind of mail, when that kind of stuff and piles of clothing or something are on the floor, there's a chance that you might trip on that. And believe me, that is the last thing you want to do. So about the home environment, I very much feel that an environment in the hospital, in a rehab center, nursing home, in your home is really critical to healing and lifts the spirit of the person. It is something that we could do so many things to have our environment more warm, nurturing, and inviting. And there is research to show that helps patients with anxiety. It helps patients, some aromatherapy with nausea. It helps patients and people to have something to look forward to that they know would instantly lift their spirits or make them feel better. What helped me, for example, after the loss of our child, I had a stillbirth baby boy, and my sister had bought at Whole Foods this gorgeous, very floral scented bouquet. It wasn't overpowering, but it was just enough that it went upstairs with me. It went into my room with me, and though it was across the room, that was something that brought me a sense of calm. There was just something about that floral bouquet. I love flowers anyway, so looking at them and smelling that every morning, I would wake up to that, and it made me feel better. There are other types of aromatherapy. Here's something else that I use. And this is a company straight from Hawaii, and they make different misting scents. And this one is called Sugarcane. It smells so good. I use this, I've had a couple bottles of this here. I will list it below. It's just something that I personally love, and it lasts a very long time in the air. And I think you could probably put it on clothing and maybe on the bedding as well. I don't do that, but I do use it in the air in my bedroom nearly every night. If you don't have that, that's okay. You can get the rollerball. You can get other things that have some sort of scent on them. You like peppermint, spearmint, oregano, orange. There are diffusers. There are candles. I'm too nervous to have a lit candle flame around people who are, including myself, right out of surgery. But you can do this. How about this kind of a thing? We've got so many faux candles now, and they are beautiful. They last a long time. There's a brand that I get off Amazon. Again, I'll list it below if you're interested. And when I it's not this one, but when I turn it on, it's 5, 6, 7 days later, it's still a beautiful glow. This happens to be a hand-blown glass item. It's a votive candle holder, or you could do other things with it. You could even put flowers in here. But this is called Glassy Baby, and it's from a company called Glassy Baby here in the Seattle area. They have so many different colors. This one my son bought me a few years ago for my birthday. But I would definitely keep this kind of thing always going throughout the house, and especially in my bedroom. But with aromatherapy, you don't have to go with something like this. You don't have to go with a diffuser, because Lysol air sanitizer has a beautiful product, and it kills 99.9% of the germs. It's called Light Breeze, and this scent is beautiful. Why not? It might uplift your spirits. If you have this around, give it a try. So I will list everything below. I will list some of the medical articles that I have come across over the years that talk about the benefits of aromatherapy. And it's beneficial, again, last but not least, to just have your space at home ready for you when you come back from the hospital. And it's okay, because if you forget some of these things, or you didn't purchase it, or it's not in your home, like me, for various reasons, you didn't get these things and you need them, that's okay, because you can order them online, or you can have somebody go get it for you. You can probably even do Instacart and have somebody stop off at the pharmacy. But get prepared, and your home environment should be inviting and beautiful and calm for you. I hope this was helpful. Talk to you at the next video.